This recording will cover treatment for disorders of the ears, and the two common ear conditions that require antibacterial drugs are acute otitis media and also acute otitis externa, which is commonly known as swimmer's ear. First, we're going to talk about acute otitis media, and that's when you think of a child with an ear infection and the pain associated with it. That is acute otitis media. So they have a nasty cold and get that ear infection with it. That would be acute otitis media. So risk factors for the development of acute otitis media include an age younger than 2, attending daycare centers, and exposure to environmental pollutants such as tobacco smoke. When the provider looks into the ear to visualize the tympanic membrane with the otoscope, usually the tympanic membrane is bulging. The patient complains of otalgia or ear pain. They may have a fever and irritability. If it's a child who isn't talking yet, the provider may ask the parent if the child has been pulling on their ear, which can sometimes be a sign of ear pain also. Streptococcus pneumoniae used to be a common cause of otitis media, but in the year 2000, it became part of a vaccine, the pneumococcal conjugate vaccine, or PCV13. And so now there's actually less instances of acute otitis media because children now receive that PCV13 vaccination, which prevents them from getting acute otitis media infections from that S. pneumoniae. Acute otitis externa is commonly known as swimmer's ear. So while acute otitis media was behind the tympanic membrane, acute otitis externa is more external. It's an infection of the external auditory canal that occurs when excess moisture and breaks in the epithelium allow some pathogen, usually bacterial or fungal, to invade the tissue. Cerumen, which is earwax, is lipid rich and hydrophobic, so it repels water and helps to protect the skin. So it serves a protective purpose. Sometimes if there's excess cerumen or earwax, it can obstruct the canal and trap the water, which changes the pH in the ear and helps and causes the protective cerumen to be removed, right, making the patient more prone to that swimmer's ear or acute otitis externa. So bacterial infection that causes acute otitis media may require an oral antibiotic, where otitis externa will require a topical or eardrops antibiotic to treat that infection. If the patient is being prescribed eardrops, it's important to ensure that the tympanic membrane is patent. A lot of eardrops, if they're administered with a compromised tympanic membrane, it increases the patient's risk for ototoxicity. One classification, fluoroquinolones such as Cipro, are effective against bacterial infections and are safe to use when the tympanic membrane is incompetent. Therefore, they're usually the first drug chosen when prescribing treatment for otitis externa. If the external ear canal becomes so swollen that eardrops cannot reach the inner recesses of the external ear canal, a wick is usually used. A wick, it sort of looks like the tip of a candle. It's a very thin cylinder composed of highly compressed absorbable material that is inserted into an edematous or swollen ear canal, so that when eardrops are applied to the tip of that wick, the medication saturates the wick in its entirety, so it delivers medication deep into the ear where the medication previously wouldn't reach because of the swelling of the ear canal. Wick should be replaced every 24 to 48 hours, and when the swelling resolves, the wick will fall out or it can be manually removed. I'm going to have you review the administration of eardrops on your own on page 99. One thing I'm going to point out to Minimize dizziness upon administration. Warm the container between the hands for at least 1 minute prior to use. After administration, maintain patient position for at least 1 minute. So if I have my otitis externa, my right ear is up for the eardrops to be administered. And then when I want to keep that ear facing up for at least a minute after those eardrops have been installed, so they don't just run it right out after they were put in. I'm going to have you review the purple nursing process box for topical anti-infectives for ears on your own. I'll just point out 2 things from this nursing process box that are sticking out to me. 1, complete culture and sensitivity testing if ordered before starting drug therapy. That's important when talking about antibiotics. If a CNS, a culture and sensitivity is ordered, you want to get that before the patient starts taking antibiotics. Also, you want to instruct the patient to complete the entire course of medication and not stop the medication when the ear feels better, but rather complete the course of medication as prescribed. In the past, antihistamines and decongestants were thought to help with otitis media with effusion, but since then there's been testing that shows that antihistamines and decongestants were not as effective as once assumed, and that the risk for adverse effects outweighs the benefits. Therefore, the American Academy of Pediatrics recommend against the use of antihistamines and decongestants for ear conditions in young children. So this is an important thing to consider when teaching parents who may have in the past, for previous children, seen their siblings use it, things like that, might have thought it was okay or encouraged to use antihistamines and decongestants for otitis media, but it's no longer recommended. So again, cerumen is earwax. It's a normal thing produced by the ear. Sometimes, though, it can accumulate due to overproduction or narrowing of the ear canal. And if it does that, it can harden in the ear canal, creating an impaction that can lead to pain, itching, tinnitus, and hearing loss. If the patient has a buildup of cerumen or earwax and is causing an impaction, cerumenolytics are what are used to break up that cerumen so that it can be expelled by the ear. So cerumenolytics are topical otic agents that soften or break up the cerumen so that it can be removed. They can be water-based, oil-based. So water-based products provide hydration to that dried earwax to help hydrate it and allow it to disintegrate, where oil-based products will, such as mineral oil, you can think of how slippery that is, lubricates and softens the earwax to help it hopefully be expelled on its own or with assistance with an ear irrigation if necessary. Carbamide peroxide is another type of cerumenolytic that, similar to hydrogen peroxide, when it goes in, it breaks down the cerumen and also hydrates it to help it become expelled. Sometimes the use of cerumenolytics on their own isn't sufficient to help expel that earwax impaction for the patient. So the patient may be prescribed cerumenolytics to help soften up the impaction and then follow up with an ear irrigation to flush the earwax deposits out of the ear. Irrigation is best accomplished when direct visualization of the tympanic membrane is possible, and it must be done gently to avoid damage to the tympanic membrane. It is also important to warm the water to prevent nausea or vomiting. Contraindications to irrigation include perforation of the tympanic membrane and prior hypersensitivity. So if you think of ear irrigation, it's almost, you could think of it as almost like a squirt gun, something that is irrigating or flushing out, in this case, the ear canal. So the goal is to soften and loosen the cerumen using cerumenolytics, and then with the irrigation, the provider, the nurse, can then flush out that built up cerumen to relieve the impaction. Again, please review administration of eardrops in Chapter 10. How to pull the ear for a child under 3 versus everyone else is a frequently seen NCLEX question. So now we have some practice questions for Chapter 44. Go ahead and pause the video to read questions and the answer on your own, and then resume the video to see if you're correct. So for question 1, the correct answer is C as in cat. For question 2, the correct answers are A and C. For question 3, the correct answer is A, meiosis. And if you remember, when I write the word pilocarpine, I write everything big except a tiny O to help me remember that the medication causes pupil constriction or meiosis. For question 4, the correct answer is C. And for question 5, the correct answer is D.